You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. With us, we have Dr. Tom Pekar. Dr. Pekar, welcome to the program.
Thank you. Welcome. Glad to be here.
Now, I know you brought a lot of photos,
Yes.
so we'll try to get to as many of those as possible. But for people that don't know your practice, who's the typical patient, and what are the different services you offer?
Okay. Well, I'm a general practitioner. Okay. We have a family practice. So the people in our practice are just a general profile of our whole community. We've got a great prevention team, and we provide fillings, dentures, crowns, bonding, the things that you'd expect in a general practice. But today, life is too short for a loose and floppy denture. Okay.
All right.
And in about an hour, we can plan this, and we can take loose and floppy and transform it into firm and friendly. Go out, have lunch, and celebrate the arrival of a third set of teeth.
Okay, so now mini implants, I guess the whole idea is taking a denture and attaching it to something is one option.
Yes.
Or just give them a full set of teeth supported by these mini implants that don't come in and out.
That's correct.
And it can be done, is this true also that it could be done in one day? Like somebody could come in on the day of the procedure, no teeth, and walk out with teeth.
That's right. We take
Really?
about a half a day to do that. We make that transformation on a regular basis, yes.
Are there a lot of people wearing dentures where you are?
If we looked at home for us, which is the Golden Horseshoe in Niagara as well as the GTA, we could fill the Sky Dome at least 10 times with people who have dentures or are going to be getting dentures within the next year.
Is that right? Because you work with denturists.
Yes, I do.
Where you are as
and
well.
I have some fabulous denturists. And I can say straight up front, I work with some of the fabulous denturists. They make a denture better than or equal to what I do. So I'm thrilled to be able to work with them.
If it's so good to get mini implants, to get a set of teeth that don't come in and out,
Right.
supported by these mini implants, why aren't all these denture wearers doing it? What's your take?
Okay, here's what I think of it. First of all, if you're not going to the dentist, you don't know what your options are. So
the denture wearers do not go to the dentist for the most part?
No, they don't. They have no reason to. Other than a sore spot or for reline, they have no reason to go to the dentist. So they're out of the loop. They don't know what's going on. Secondly, they've probably self-diagnosed. They said, well, I'm too old, I've got a little bit of diabetes.
How old can you be to do this?
Well, I'll tell you about my friend and mentor, Jean. We just celebrated her 99th birthday in August. And we've already booked for her 100th, and the restaurant owner said she'll have her dinner for free.
But why would a 99-year-old want to do this?
Because at 99, she still wants to eat and chew and talk. And let me tell you, Jean can carry on a fabulous conversation. I think she'd rather talk than eat.
Are they more likely to fall out when you're that age?
No, not at all. She's got fabulous bone. Jean is a very, very young 99. She likes to eat anything she wants to. She can chew anything she wants to. And she likes to carry on conversations with me that go on and on and on. She has a fabulous memory, and she remembers things back to way long ago. She was an Army nurse in World War II. So she has a fabulous wealth of information, and I gobble it up. So she likes to also tell me, she's been my mentor, as a matter of fact, for dealing with seniors and their health issues. So we talked for a long time.
So you're never too old to get this?
Never.
Get this
So
done.
if you're 99 or under, you're automatically in.
I mean, isn't it true? If you're wearing dentures for like 20 years, you don't have enough bone to get this done.
That may be true, depending on that dentist's experience and the imaging system that he's using. And so we're finding that's not the case. We can usually find some bone, or we can grow some bone, okay, to get done what we need to have done.
Now we should mention, I guess you've been doing dental implants for 25 years.
That's correct, yes. I was one of the early adopters in this whole stream, and it's been fun. I met some fabulous, wonderful people along the way, and it's been great. The difficulty has been its affordability. So I discovered affordability about 8 years ago with the mini dental implants, and since that time, things have just skyrocketed right out of the park. So we can literally take someone in a day or in a half a day who can't eat, can't chew, has all sorts of other issues, and we can give them a third set of teeth, and you know what? Their lives change. They can eat whatever they want to. So anything that's chewy, crunchy, snappy, it's easy, okay? They can whistle, they can sing, do all sorts of things like that.
I mean, you could chew like a chewy food, like a pizza or nuts. Could you eat nuts? Or there's a lot of limitations?
Jean's favorite is cashews and hazelnuts. She can crunch those really, really well.
So it doesn't matter.
No, not about it. And then ribs. Oh, you'd love to have ribs. Denture wearers can do ribs. They get in there. We have a rib fest. Okay.
Really?
Yeah. I'm a Rotarian, and we've had 18 years rib fest, and I can always tell who has dentures, who doesn't have. So the denture wearers all get pulled pork.
Okay.
Okay, and the people who've got their own teeth, or they've got implant secured teeth, they're getting right in and they're ripping the meat right off the bones. It's really wonderful to see.
Doing what you do you get a lot of eating stories?
I get lots of eating stories and kissing stories.
Really?
Okay, yeah. So one fella came to see me and he said, "Look, you know what, Doc, you got to make me more kissable." Okay, I said, "What do you mean?" He says, "Well, I went to kiss my wife and she turned away." She said, "Oh, your breath."
Because of his denture or the bad teeth?
Well, it was the bad teeth. So, we took care of him, okay? And I saw him in the mall a couple of months later, and I said, "Well, how's it going?" He said, "Things are looking really good," as he strutted away down the hall with his wife. So, yeah.
What about if you have bad gums, like gum disease, bleeding gums, bad breath, loose teeth? Are your gums too bad for the mini implants?
No, they're not, because those are the people who we really want to see. They are headed for dentures sooner than later. So by the time we take away the bacteria and we place our mini implants, the infection's gone. It's all about the bone and having the bone healthy, and the mini implants help to do that.
Now you use your laser, I guess, to also clear up this bacterial infection?
Yes, we do. Yes, we do. And it's very nice because we can take our laser and we can vaporize around the sick, bleeding gums, turn them into healthy gums, take the bacterial infection away, and now we have an ideal, perfect healing site. It's a win-win.
Is this the future of dentistry, where traditional dentures, and I guess you work with the denturists in town, you work together.
Yes.
That the future of dentistry, whether it's 20 or 50 years, that everything will be stabilized to something?
This is
what you're thinking?
This is what I'm finding. The problem with dentures, Randy, is they're not attached to anything. So what happens? They bounce. You can't eat into a steak. You can't bite into a pork chop. You can't chew into a pear. You can't chew into an apple. You can't crush cashew nuts. Okay, and if you go into baby back ribs, which is one of my favorites.
Yeah, you mentioned. So
you can't pull them off if you have dentures.
So I know a couple of denture wearers. They never complain about anything.
Well, of course not, Randy. They're not going to complain to you because but I'm a dentist. They come to me.
Okay, that's a good point. Okay,
but then you've met my mom.
All right.
Okay, so when we were kids growing up, it was the Holy Trinity on Saturday night. Hockey night in Canada, okay, Red Skelton and Carol Burnett. So we were watching one of the Carol Burnett skits, okay? And you know how it is, they get on with Harvey Korman and they're splitting a gut and they can't hold themselves back. Well, Mom was trying not to laugh, okay? And at one point she
she was wearing a denture?
Well, she was wearing a denture, so she's trying to hold herself like that, and at one point she couldn't do it. She howled, okay? The dentures flew across the room and they smashed against the TV. We thought the TV was broken. Okay.
Wow.
And after that, she stopped bragging about how she could eat apples with dentures. It was really quite funny. But you'd be surprised. You know that glue that goes on side of the dentures that people wear? Okay. You'd be surprised how much lint and dog hair that it picks up.
Is that right? So are you saying then the denture wearers that aren't doing this, they say it's fine, it's because they've just adapted?
Well, they think this is as good as it can get. And they'll live with that. So let me tell you about my dad.
Okay.
Dad had this was way back early on. Okay. So Dad had a toothache. His dentist said, Jim, you need to have a root canal and a crown on that. And so this was over the weekend. He was suffering. Mom said, why don't you just have the rest of your teeth taken out like I did 15 years ago? I've got no pain, no suffering. I'm not going back to the dentist. I have no big bills. Okay. And he said, okay. So he went in on Monday, had general anesthetic, all his teeth out, plates by Friday. Okay, well, that's great. And so for Dad, this was wonderful. He had no pain, he had no suffering. Because for the past 30 years, he'd be going back and forth to the dentist. He'd have a broken tooth, he'd have a broken filling.
So this is everybody?
This is everybody.
Before they end up in a denture?
Absolutely, everybody. And so, bleeding gums, bad breath, all of these things. So finally, it's out. He's thrilled. Now, what I didn't know is that Dad didn't have freezing or local anesthetic for any of his dentistry. He had it all done. So now Dad has a phobia about going to the dentist. No matter what, he's not going back. So he doesn't know what his options are. His only problems are he gets a sore spot occasionally, and he goes to a denturist then to have that taken care of. He doesn't go back to the dentist, okay? He doesn't know what his options are, and he's thrilled not to go back to the dentist.
But his son's a dentist, though.
Oh, no.
Were you doing dental implants at this time?
I'm not the family dentist.
Okay.
No, there's a real line there, you know. So it's like, okay, I raised you, I changed your diaper, you're not going to tell me what to do. Okay. I said, okay, Dad. Okay. So I had him see a friend of mine. Okay. So Dad had dental implants put in, he had new teeth coming in, and let me tell you, it wasn't a revelation, it was a revolution. Okay?
Really?
Because what we had seen up until that time, Dad couldn't eat very well. Dad was this outgoing Mr. Personality kind of guy. He had a joke, he had a story, he had a laugh for everybody. He knew everybody, everybody knew him. When he had all of his teeth out, it didn't go so well. So he went from disappointment to a little bit of delusion and almost into depression. Mom had to cut up all his meat into little pieces. She would finish his sentences because he never could figure out how to play hockey with that denture on the bottom. With my dad's situation, there's tens of thousands of people who are experiencing the same thing.
Who can relate to what you're telling me.
Exactly. So as I say, things didn't go so well for Dad. Okay, and so he decided that, you know, this is just not right. He was feeling a little bit depressed. He wasn't the social animal that he used to be. He couldn't eat pears straight off the tree. Couldn't eat apples straight off the tree. He couldn't eat carrots. None of those things were his favorite foods. Even hot peppers he couldn't eat anymore. So I sent him to a friend. Dad got teeth that snapped in and snapped out. He was absolutely thrilled. What we experienced as a family was Dad said, look, just a second, I'll tell that story. I can talk now. Don't you tell me anymore I can do this. So Mom wasn't finishing a sentence anymore. We had story after story coming out, jokes.
So his personality came back.
Oh yeah, no, it didn't come back. We had a new dad. It wasn't the old dad. This was bigger, better version than what we'd had before.
And it's just teeth?
Just teeth, because what happened is that we had opened Pandora's box. The genie came out of the bottle and it was not going back in. Let me tell you, this was a revolution.
So when I have dentists on my show and they say, well, the mini implants aren't there yet.
That's not true. The research has been out. There's a 10-year study showed the results are exactly the same.
As a traditional implant?
Exactly the same.
Okay, good. Now you brought photos.
Yes, I did.
Now you say you're changing people's lives.
Well, you know what we do is we remove the stumbling blocks. They change their lives. It's a fun process.
All right.
So let me tell you about Terrace. So what we're seeing here is an upper denture that has to be kept in place with glue, and bottom teeth that are not going to last. So he was miserable. He'd gone to a number of places, and they said, you know, you need to take a piece of your hip and put it up in your jaw to give you some bone to put implants with. And he really didn't want to do that. So we found a place in his jaw to find 4 mini implants. So we put mini dental implants in and gave him a new teeth on the top that snap in, snap out. And he's thrilled because he can eat cashews, he can eat burgers, he can eat sandwiches, things that he hasn't been able to eat in a long time.
So they're snug. I mean, these things...
They're snug. They're rock solid. He can laugh, he can smile, he can sing without fear of the teeth falling out and no glue. And that's the biggie. People are
They
thrilled.
hate the glue?
Everybody hates the glue. Everybody hates the glue. It's no fun. As a matter of fact, if you go to a family restaurant and you see a person of a certain age, they say, well, I have to go to the restroom. Well, maybe they're going to the restroom, but probably what's happened is they've got some food stuck underneath their denture. It's stuck in the glue, so it's an irritation for them. And that's really embarrassing for someone to go to the bathroom, take their denture out, flush it underneath the sink, put it back up again. And so usually they go in twos. One minds the door, and the other one, so they take turns.
Is that right?
Yeah.
They've told you this also?
You wonder why girls go to the bathroom together? That's one of the reasons why. And here's another one.
All right.
I mentioned to you about my friend Jean. Father time has not been.
What is this? Is this the lower or upper?
Well, that's upper teeth. That's all that she's got left. Okay. So I told you, Jean was a nurse in World War II in the Army. Okay. When she retired as a nurse, she was the head of the public health unit. Okay. She has mentored me on how to care for older people as they go through time. And this is Jean today.
So what did you do for her?
Well, what we did is we gave her teeth on the top and the bottom that are snug, solid. She can eat cashews. She can eat candy.
And she's 99.
This is 99 years young. She has all of her faculties together, and Jean can talk really well, a lot.
So when I hear like an 80-year-old, I don't hear this, but if I'm sure 80-year-old saying I'm too old for mini dental implants.
Yeah.
That's just not the case.
No, it's not the case. So I will say if you're 99 or less, it's good. Now, we've already booked her 100th birthday dinner for next August already, and the restaurant owner said she gets free dinner. So let me tell you about Nancy.
Wow.
Wow, exactly. So let me tell you about Nancy. She came to us 4 weeks before her 25th high school reunion. She said, I have to go. Can you please help me?
This has got to be completely unusual to see something this bad.
You'd be surprised. This is more usual than not. There's a lot of people who really don't show their teeth, don't go out, don't work.
So they just never smile, so you don't see
They just never smile. It took us
Really?
10 minutes to get that picture. I had to threaten her, unless you show me your teeth, we're not going to proceed. So fine, that's not a smile picture. That's a show me your teeth picture. Okay?
Wow.
So yeah, she was very embarrassed, okay, not happy, wasn't eating. What were her options? She could have a traditional denture, or she could have implant retained teeth. So here's what we did. 2 weeks before the reunion, we were going to have the reveal. And as I handed the mirror in front of her, I leaned over her shoulder and I whispered in her ear, Nancy, welcome to the next day of the rest of your life. Wow. And she looked in the mirror and she said, oh my God, okay. And the tears were coming down. She had never looked so good.
So this is teeth supported by mini implants.
Yeah. And so she had never looked so good. It took 10 minutes for us, everybody in the office, to settle down because we were all crying as well. Okay. But that's not the end of the story. Okay. Cinderella went to the ball. Okay. And when
her 20th reunion.
Her 25th reunion, she went to the ball and all the girls hated her because she weighed the same thing as she did in high school. She hadn't been eating all of these months, okay? And the guys were all crowded around her like moths to a flame because there was this mousy, quiet little schoolgirl from before that they remember, like, who is this drop-dead gorgeous woman there is now, okay? And you know, she hooked up with an old flame. So, and it wasn't just sparks, there was fireworks.
All because of her smile.
All because of her smile. She had a relationship, okay? So life was not good. Life was fabulous for her.
Has she told you this? Is she allowing you to tell the story like this on the show?
Yeah, that's exactly what she told me. And so she hooked up with her girlfriends in school. They had promised in school, you know, we're going to do the trip to Europe. So they got their backpacks. They spent 6 weeks in Europe. They went around. They experienced things like eating crusty French bread with camembert cheese melted over top.
That a denture wearer would not been able to
Impossible. They were eating really hard Italian cheese. They were eating dried German sausage. They were eating baked walnuts over top of figs drizzled with balsamic vinegar. These are things she never ever would have tried, mussels, clams, all sorts of things. And so life became really, really good for Nancy. She was thrilled. And, you know, a couple of years later, her sisters and some of her friends came to see me. And they said, you know, thank you for giving us our sister back. Thank you for making our family complete. And thank you for giving Nancy the very best years of her life. That's the challenge. There are thousands of people like that are out there who have just given up hope. They don't think there's anything for them, and so they just stop living. So let me tell you about Lyle, okay? Lyle came to me.
Oh my goodness.
And said, you know, I can't eat, I can't chew, I'd love to have a steak. I'd love to have something more than just ABC food, which has already been chewed food. Lyle had a couple of options. He could have, you know, standard dentures, top and bottom, that would slide away with a little bit of glue, okay? Or he could have mini dental implants. And he said, you know, I want to have teeth that don't come out. I want to see them fixed so that when I smile and when I laugh, they stay put. And so this is what we've done.
And they look like real teeth.
And they do. They look like real teeth. And he's thrilled, I'm thrilled, his wife's thrilled. Everybody's happy with it.
So what about maintenance once he has this done?
Well, with those, what Lyle does, he brushes regularly, he water picks regularly. He comes to see us, and we make sure everything is looking good for him. Yeah.
So they come back for regular checkups.
Yeah, they come
to the dentist,
twice a year.
Cleanings.
Twice a year, he comes for his checkup, and he works out really well for him. Yes.
Now with him eating, he can eat whatever he wants.
Anything he wants to. He can laugh. He can
ribs.
Sing,
he can eat
jump.
ribs.
Yes. He can do any. Ribs are fabulous for him. Yes.
For men, I'm just curious.
Yeah.
Is it more about chewing and eating, or is it more about the appearance of the smile?
Well, you know, it's interesting you mention that, Because most guys say to me, and I'll say, so, how can I help you? And I say, well, I want to eat beef jerky, or I want to be able to chomp down onto a steak or ribs or something like that. And so we give them a new set of teeth, and all of a sudden things change. They say, oh, they will look a little better. They get a compliment on their smile. Oh, you look so good. And, because most guys that I see, they belong to the over 50 over club. Do you know what that is?
Tell me.
Okay, that's the over 50 years of age and 50 pounds over. Okay, and you know what? It's a whole lot easier to give them a whole new smile than it is for them to lose 50 pounds. So it works really well for them. And the same thing happens with women. So typically I'll see a lady where she'll say, the kids are gone, school is done, now it's time for me. And I said, how can I help you? She says, well, can you just sort of brighten up my smile a little bit? And so we matched the tooth shade to the eye shade. Okay. And then I said, what else? Well, I'd like to be able to eat nuts again. I'd like to be able to eat carrots and celery because I want to, watch my weight and my figure. And I said, okay, we can do that. And I said, what else? She says, I want you to make me amazing. And I'm thinking, well, we can do 2 out of 3. That's really good, And then I'll bump into them a little bit later. And what happens is that where they thought they wanted to just freshen up, they've gone from amazing to totally awesome.
Because they're smiling now when they meet people?
Because they're smiling, they have the self-confidence.
Really?
Okay? They have the self-esteem that they had before they got married and had kids, because they're transforming their lives now. Okay? They realize that, I've got soccer games to go to, I've got baseball, swimming, dress rehearsals, all those sorts of things, and they want to be part of their grandkids' life. They have to. That is their new life. Okay? And they've got parties to go to. They've got anniversaries. They have birthday cakes that they have to blow out the candle with the 1 and 2-year-old, and they don't want to blow their dentures all over their teeth, like my mom did on television. Okay? They're very concerned about that. So what happens, they just perk right up. It's wonderful to see. I don't do it, they do it.
Is this the happiest group of patients in all of dentistry, you think?
It's wonderful. But let me tell you, the happiest group. The happiest group is what we have, I call them the titanium triple crowns. Now, the triple crown, is the horse races.
Yeah.
Okay. The titanium triple crown patients are the ones who've had artificial knee, artificial hip, and now it's time for the artificial teeth. And so you may think, well, why would someone go through all of that? And they give me the same thing I've got to go to my grandkids, all those things like that. And I say, well, how long did it take you to decide about the hips? About 10 seconds. And how about your knees? About 5 seconds. And how about the teeth? About 1 second. Because they are fully engaged in life. They want to be part of everything that's going on.
So nobody should be wearing a loose-fitting denture?
No, not
we said that
today.
at the top of the show. You believe that?
Yeah, I really believe
that's your mission?
That's my mission. Dad gave me the mission, find an affordable way that the average person can afford to have teeth that don't come out, that don't slip, slide away, that you don't have to play hockey with your tongue with. Let me tell you about Jean, okay? This is how she came to us, okay? And she really couldn't eat anything except on her front teeth, so she could only nibble little bits here and there, and she wasn't happy. And we tried a number of different things, and finally she said to me one day, she said, Dr. Pekar, please, I've had enough. I can't do any more root canals, crowns, partial dentures. Can you please take out all of my teeth so the misery is over? And I want the whitest teeth that you can possibly give me. So we gave her 2 arches of teeth that do not come out, that are white, white, white.
Wow.
Okay? And she's the happiest camper. She doesn't think at all about what it is that she eats or doesn't eat. Everything is fair game on the table, and she can chomp and crunch through absolutely anything.
So I've never asked a denture wear this, but they have to, they're always considering what they can eat based on their denture. Because I don't think of anything having to do with how tough it is or...
Okay, well, let me tell you how it is for denture wear, okay? You go into a restaurant, you look at the menu, they've already know the menu inside out. And what they say is, what foods can I eat in front of my friends and family, or what do I really want to eat? And so what they do is they go to the ABC food, which means already been chewed. So that's
soft
is pureed foods, okay? So when I get invited to lunch at one of the homes that I go to, okay, lunch is three colored stripes on the plate. So one is white, one is brown, and one is green. Now, it's okay nutritionally, but it's not a whole lot of fun. They want to eat real food. They want to be able to crunch into a carrot. They want to be able to...
And you can do that with these mini implants supported by, with the full arch.
Yes, you can. You can eat whatever you want to, and it's not a concern.
But it seems like everybody would want the teeth that don't come in and out.
Well,
because I know you offer the snap in, snap out.
Yeah, we do.
But people must want teeth that don't come in and out.
That's what everybody's preferred.
So it's just a little more expensive.
It's a little bit more expensive to do. And
Insurance doesn't cover this. We need to mention that.
Yeah.
You have financing available?
Yeah, we have financing available, yes. As a matter of fact, one of our preferred financing is a credit union. And I went to them and I said, look, you got to help us find an affordable way to finance this for the average person. They said, okay. And I said, well, why would you even consider doing this? Because you don't do healthcare. And they said, well, you know, we look at someone making an investment in their future health, the equivalent to making a repair on their roof or their foundation. They're not going to walk away from this.
That's good.
Yeah.
That's nice to hear.
I was very surprised.
So you'll work with them with financing, things like that. We
Yes.
probably have time for just one more
One
photo.
more? Okay, let me show you Irma. She came to us with not a whole lot of teeth. And she says, I want teeth that don't come out. Exactly as you mentioned.
So these teeth have to be extracted.
Yeah, they're coming out, that's right. We kept a couple, okay, the ones that were great, and here's what she came out with, okay?
Very nice.
And she never stopped smiling. There isn't a mirror that she can't walk past and say, okay, I think that was a good decision, I can good. And when she's with her daughter, she's mistaken for their sister. It's really fun. Okay?
All right.
Now, let me show you. This is Jane. Just for whatever reason, a bunch of teeth had to come out, and so we replaced them with implants and crowns, and here she is now.
So they're like your own teeth in a way.
Like your own teeth that don't come out. Okay, and she's thrilled. So I mean, I didn't give her the yellow convertible, but in her mind, but you see, in her mind, she was a convertible kind of girl. And that was the transition to give herself the permission to do that.
Now, you mentioned earlier, we're out of time, but you mentioned earlier in the show, a lot of these people that are in dentures, because they went through so much and money saving their teeth, they have their teeth out, it's hard to get them back in, right?
Yeah.
What do you do for these fearful patients?
Well, you know, we can ease them in and out of the twilight zone, and they come back out.
Like a little bit of sedation?
Yeah, with sedation, we can do that. With a pill or nitrous oxide, so they come back out with good memories.
Okay, good. Final message. Somebody watching this, their teeth are failing really bad, or they're currently wearing a denture. But for some reason, they're still afraid. What do you say to them?
Okay, you know, if you've had a bad experience, if you have had someone tell you that you're too old, you don't have enough bone, that someone has said, look, I can't understand what you're saying, put your dentures back in and it still doesn't help, okay? If you find that you're not eating your favorite foods and you're moving to the ABC section, okay? If you find you're not being included in conversations, you're being outed because you don't feel you can participate, okay? If you feel that there's some kind of stumbling block between the not being well where you are today and the happy, healthy future you see yourself as being, you know, give us a call. We'll listen. And maybe soon.
So know your options. I mean, they should go in and see you.
Okay, and maybe soon I'll be able to pass you the mirror and I'll lean over your shoulder and say, welcome to the next day of the rest of your life.
So I want to thank you for coming on the show.
Thank you.
Very good. And if they go to your website, they can take a look at all these?
All the procedures are there.
All right. Thanks again.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.